We will discuss recommended approach to diagnosing MGUS and determining if further testing is necessary.
MGUS is typically found incidentally, meaning it's often detected when looking for another health issue. For instance, people might be evaluated for MGUS if they have unexplained bone loss, high blood protein levels, protein in the urine, or certain types of nerve problems. Screening for MGUS isn't recommended in the general population due to the low risk of progression and high cost of screening. However, in people over 50 with multiple first-degree relatives affected by multiple myeloma or related disorders, screening may be considered.
For those who need evaluation, basic tests include a completed blood count, measurement of serum calcium and creatinine to assess kidney function, and serum protein electrophoresis with immunofixation to detect abnormal proteins.
We also perform a serum-free light chain (FLC) assay and quantitative immunoglobulin testing. If an abnormal M protein or FLC ratio is found, additional urine studies may be needed to detect any kidney involvement, which involves a 24-hour urine collection with electrophoresis and immunofixation. Imaging studies can help evaluate whether there are any bone lesions, which may suggest progression to a condition like multiple myeloma. For most individuals with MGUS, whole-body low-dose computed tomography (CT) without contrast or whole-body magnetic resonance imaging (MRI) is preferred, as these methods are more sensitive than standard X-rays. However, imaging may not be necessary for those with low-risk MGUS, such as those with a low M protein level less than 1.5 grams per deciliter and a normal FLC ratio, as their risk of bone lesions or myeloma is low.
A bone marrow biopsy is generally reserved for individuals with concerning lab findings, including anemia, elevated calcium, kidney impairments, or abnormalities on imaging.
It is also recommended for people with M protein levels of 1.5 grams per deciliter or higher, those with IgA type MGUS, or those with abnormal FLC ratios, as these features may increase the likelihood of progression. In individuals without concerning signs, such as anemia, enlarged lymph nodes, or an abnormal FLC ratio, a bone marrow biopsy may not be needed, particularly if they are older and asymptomatic. Models such as the iStop-MM risk model can help determine the need for bone marrow biopsy by estimating the risk of MGUS progression. This model considers factors like MGUS type, M protein level, and immunoglobulin concentrations, and it may help avoid unnecessary bone marrow tests in low-risk individuals.
This approach to diagnosis helps ensure that each person is evaluated according to their risk level, balancing the need to detect progression early with the goal of avoiding unnecessary testing for those at low risk.